The end of life can be a very hard time, and if someone has no family or close friends to share that time with, it's even worse. Ute Schmidt is manager of spiritual services for Baystate Medical Center. She spoke with me about No One Dies Alone. It's a volunteer effort aimed at making sure no one in our area is without support and companionship in their final days.
We attend to those needs. People are afraid of being in the hospital. People don't like being in the hospital. People ask themselves really deep existential questions when they're in the hospital. Why am I here? What's coming after this? Am I still the person I used to be? What's going to happen with me when I come out? Where do I go from here? Especially older people ask that question, but also the younger pediatric patients ask those questions already, and that's fascinating for us.
We've brought you in specifically today to talk about something that I had just heard about through the folks at Baystate and wanted to make sure we let people know about this. It's a program that the name says it all. No One Dies Alone. You, some of the staff members at Baystate, volunteers in the community, have banded together to make sure that if you learn of whether it's a patient leaving hospital care and going back to home or some other situation where perhaps they don't have family, perhaps they don't have close caregivers, whatever the situation may be, if someone is terminally ill, you all work to make sure someone is seeing them, someone is with them in those critical, maybe difficult final days of life.
Yes, indeed, we do. It goes back to 2005 when some nurses and our chaplains identified quite a few patients who passed on at Baystate all by themselves with no family members or friends available, and it broke our hearts. And we felt strongly that we should do something about that, because our first mandate is to make sure that patients feel cared for at Baystate at any time of their illness, but especially at the end of their lives. And we also talked, nurses, physicians, social workers, and we chaplains talked about it. What can we do? And we discovered the No One Dies Alone program, which was founded by a nurse in 2001 in Eugene, Oregon, at Sacred Heart Medical Center. She was a nurse and who had the experience of not having time for one of her patients who then died alone. And out of that heartbreak for herself, she developed alongside other staff members at Sacred Heart in Eugene this program, the No One Dies Alone program, that we basically follow. We modified it to our needs, but we follow. It's a training program that trains volunteers to be able to offer their human presence, a touch, a word, and their gentle, calming, soothing presence for someone at the end of life, someone who is alone or someone whose family basically needs a break. Sometimes families have to take care of business at home, and for them it is a comforting thought to have a volunteer sit with their loved one while they have to take care of their house business or other things.
Let me ask you, this is a wonderful thing to do in any way you look at it or think about it, but it cannot be an easy thing to do. It is a tough time of life. It's something everybody thinks about, and I think most of us, to some degree or another, are a little frightened about anything that's uncertain. And we don't know what will come, what will happen before death, and the difficulties and the indignities that may be part of it. To work with someone who's going through that must be taxing itself for your volunteers, your healthcare professionals. How are they prepared? How do you prepare to do this?
The volunteers are, of course, carefully selected. So we have an interviewing process. We usually advertise at Baystate itself, but in the organization and beyond, in community resources and churches, and we interview our volunteers to see where they're coming from, what's the motivation, what's the maturity level. And we have a training program that consists out of approximately 18 hours. We meet 3 times over 3 weeks and train them in learning about death and dying, what it looks like physically and what it means psychologically for the person. And we talk about their experience. They need to integrate their experience and not project their experiences on the person.
I would imagine you're often dealing with people in our secular world today for whom spirituality, ideas of faith or religion, whatever they may be to any individual, may have been something that kind of was left aside, fell by the wayside as the years passed through life, and now facing the end, old beliefs perhaps come back, or you want to have beliefs. It must be in some ways fascinating is a terrible word to use perhaps at this time, but quite a process to go through with someone, I would think.
Yes, indeed. It can be challenging. It can be moving. And let me clarify, the No One Dies Alone program is a non-religious, non-spiritual program. It's really about the human presence. That is universal. And that's the way we understand spirituality, too. And, of course, there are questions, I usually call them meaning questions, existential questions that come up at the end of life. And we, as chaplains, are trained to attend to those questions with an open mind. It's not about we bring our belief system into the patient's room. It's about attending to what gives meaning to the patient. And so that's how I also engage with the volunteers. I don't expect them to have any particular religious or spiritual beliefs. It's about the willingness to bring your human presence into the moment. And that in itself is valuable, worthwhile, and meaningful.
Mm-hmm. Well, Reverend Ute Schmidt, Manager of Spiritual Services, Clinical Pastoral Educator at Baystate Medical Center, thanks for coming in. Thanks for telling us about No One Dies Alone.
Thank you so much for the invitation.